Can Chiari, certainly I know syringomyelia can do permanent damage, but can something like Chiari do permanent damage that maybe can't be reversed after a decompression? I know it's not quite the same as injury to the spine, but I'm curious how that works.
Yes, yes. There are any number of things that can become permanent if a Chiari is causing symptoms, severe symptoms, and it's not addressed. Um, People do develop the variant of idiopathic intracranial hypertension to the point that they lose their vision. And if that goes on for too long, it's not reversible. Um, People lose the facial muscles, or the muscles atrophy in the face so that they almost look like they have a mask-like faces. And a lot of the time these patients are sent to psychiatry for having an abnormal affect when actually they have a Chiari, which is causing them to not be able to have facial expression the way they should. There's arthrogryposis, in which the fingers kind of draw up like this, and that's from a scoliosis. That will reverse if it hasn't gone on for too long, but if it has, a lot of the time people still have deformities of the hands, loss of muscle in the hands, in the hand intrinsics, weakness in the hands, loss of muscle in the arms from ongoing syrinx. So yeah, and then of course scoliosis is a sign of damage. The syrinx is a sign of damage to the spinal cord. It's just whether or not it's going to result in lasting permanent deficits. And we really want to get it taken care of before any of these things happen or get worse.
This might be an unfair question, but do we know what that time limit is? So say, say this person knows that they've had Chiari from day X, and how long can that person realistically wait to have surgery before maybe they should do something about it?
That's really tough because everybody's different. When I talk about symptoms that I really don't want to watch or sit on, progressive scoliosis, a syrinx of any size, people who are passing out, having syncopal events, people who go paralyzed on one side of the body for 15 minutes, a half hour, several days, people who aren't able to walk. Those are more ominous symptoms and signs to me that really need to be addressed. When someone says, well, how long can I wait? And sometimes the patients ask this. The issue is that Chiari causes gradual symptoms most of the time, and people get used to how they've been. So no matter how bad it is, a lot of the time they're afraid of surgery because they're thinking, it's such a big surgery and I've kind of lived with it for this long, or I've lived like this. And they don't see, necessarily how bad it's gotten. If you went from normal, completely normal one day, to not being able to walk and not being able to move one side, and all of the Chiari symptoms, choking, gagging on food and liquids, dizzy, ringing in your ears, ear pain, throat pain, choking, you would be in emergency. You would be wanting an emergency surgery.
Yeah.
But because things happen gradually, a lot of the time, people are trying to manage it and live with it, and then I can't blame them for that. I mean, surgery is scary.
Right.
But the symptoms and signs that I've mentioned, I think, are ominous and really need to be corrected if they can be.
A question just came up that kind of gets to this. So how often do you recommend surgery? And if you don't recommend surgery, how often would you want to see the patient to come back to make sure that there's nothing progressing there?
Everybody is different. I'm not sure how many patients I see that I recommend surgery versus don't. That changes, I think on a daily or weekly basis, just depending on who walks in. And a lot of the time the patients have been already diagnosed by a neurologist or another neurosurgeon and sent to me. So, that's a hard question. I can say I don't recommend surgery, certainly for everybody. But when I see the signs that are more ominous, then I do. And I recommend it more urgently for those people within a couple of months. If someone has had symptoms ongoing for more than 6 months, they have more bad days than good. They're not able to function because of the symptoms, or they're not able to function without taking medications every day uh, for more than 6 months period of time, then in my mind they are a good candidate for surgery if they have Chiari malformation.
Mm.
Uh, medications lose their effectiveness over time, and then people have to be put on more and more medications to achieve the same effect, and then the medications have side effects.
Of course.
That said, about 40% of the time, this is where it really gets complex. About 40% of the time, Chiari symptoms will get better or on their own or completely go away. So everybody doesn't progress. Some people get better. I've seen patients who have, what I refer to as signs of having been very symptomatic. So you'll see someone who in the office who says they don't have any headaches, they don't have any pain. Um, they were in a car accident, got a scan, and were found incidentally to have a Chiari. And then you look them over. They've got scoliosis. Maybe one hand is bigger than the other. There's some loss of muscle in one hand. There's nystagmus, but they have no symptoms. But then when you ask about all the other Chiari symptoms, they had, bad headaches in elementary school. They had a lot of dizzy spells like 10 years ago, but they just went away. There were Chiari symptoms over time that just kind of went away. And Chiari itself, the abnormality, the tonsillar herniation, can go up and down over time on its own. So, yes, people can get better on their own without surgery, but it's a surgical problem. 70 to 85% of people just across the country, across the world, get better with Chiari decompression. About 40% get better without. So there's no comparison to conservative therapy and watching people versus doing surgery. If you want to have conservative therapy, you don't want surgery, then you can be watched. And deaths from Chiari are rare. So if you want to be watched, you can, but you don't have to be. And there's no period of time that you're symptomatic with Chiari that you have to just keep coming back and coming back and coming back until finally, okay, we've watched you long enough, let's do it.
Yeah.
That's not my practice.